We checked in at 7 in the morning, which is pretty early for me. I'm not quite an early riser. And then we did the blood work. But then after that, the rest of my day, I kind of had the day off after that.
Well, we always have this joke about how hospitals are hurry up and wait, get here at 6 a.m. so you can wait 24 hours for your surgery, you know.
Yeah, I can remember just kind of sitting in conversation with my mother prior to going into the operation, just kind of sitting in there, you know, in the waiting room, kind of just getting ready and just chatting, you know, very, very casually. You know, I think, you know, we both were ready. You know, we weren't nervous at all.
I just recall the moment when my dad just reached his hand over and grabbed my hand, because our beds were pretty close. And he says, "I'm ready," you know, and he kind of gave me a smile. And
there are two ways of doing surgery to remove your kidney. One is an open technique, and what we do is we make an incision in your back here about 10 centimeters long, just enough to remove your kidney. Now another method is to do it what we call a hand-assisted laparoscopy, wherein we make a few small holes in the front and remove the kidney. And at the time when the kidney is removed from your body, we'll make a small incision down in the pelvic area, about this much, again, just enough to take out the kidney. And that scar usually is hidden if you were to wear a bikini.
They put in a camera through here. I'm not sure what's the name of it. It's like a little camera to guide them. And that was it. That's all they did. You know, they took out my left side, my left kidney, and it was quick.
When you're getting up and down for the first couple of times, it's uncomfortable and it's awkward because you have to get used to the fact that you just had surgery and they cut through a muscle, but it did heal fairly quickly.
Yeah, I remember just waking up from the surgery, and I think one of the first things that I asked was, you know, how's my mom? You know, how's she doing? And my wife told me she's doing great, that the kidney's working fine, and it started working, you know, before they can completely finish the surgery. So, you know, it's good to hear.
I am still sleeping in my hospital in the room, and I can hear somebody saying, "Where's my sister? Where's my sister?" And it was my brother who was walking in the room with his Dodger cap and with his nurse, and she's like, "I'm trying to slow him down. He's looking for his sister." And that was like the biggest highlight, because I had thought about that for months prior.
I woke her up, and I was a little concerned at the time because she's sleeping, and her smile said it all. And I'm sure my smile said it all also.
It's the most immediate gratification to see someone so sick the day before the transplant and 3 days after the transplant so well. Lance, I'm not kidding you, was ready to roll. He was ready to vacuum. He was ready to conquer the world. And it makes it all worth it for you.